Ever catch yourself, like, in the mirror, kind of prodding at those little dark triangles that show up between your teeth?
Yeah.
I know, right? I've totally been there. And you know what? It turns out you're not alone. You've been looking into this whole thing.
Right.
And let me tell you, it's a rabbit hole in a good way. So today, we're doing a deep dive, get it, a deep dive on black triangles,
Okay.
or, to be all official, open gingival embrasures. But black triangles, that's what we're calling them.
Yeah.
We've got this super interesting article, and we're going to break it all down. What causes them? Are they actually bad news? And what can you even do about them?
Sounds good. What always gets me is we think of our teeth like they're just these separate things.
Well,
But your gums, they're like the VIPs here, way more important than people realize. And those black triangles, think of them like little warning signs, you know? Something's up with your gum health, they're trying to tell you.
so it's not just a cosmetic thing, because if I'm being honest, that's kind of what I was worried about, how they look.
Well, yeah, I mean, they can be a cosmetic thing. But here's the deal. Those triangles, they happen when your gums pull back, right?
Right, receding gums. Yeah, I've heard that.
Exactly. And that recession, often it's a symptom. Like the article said, gum disease, that's a big one.
Yeah, I talked about gingivitis and periodontitis, and honestly, I always thought those were like the same thing, just different names.
Ah, I see. Okay, well, they're related for sure, but there's a difference. Gingivitis, that's like the early stage, your gums are inflamed. Good news is usually you get on top of your oral hygiene and it's reversible.
Okay, phew.
But if you let it slide, that's when it can turn into periodontitis.
So that's the more serious one.
Yeah, periodontitis, it's a whole other ballgame. It's not just inflammation anymore, it's an infection.
Yeah.
And it's attacking the tissues, even the bones that hold your teeth in place. Remember those receding gums we were talking about? Well, with periodontitis, that infection, it can actually eat away at the bone, and that leads to even more recession, teeth that get loose, and yeah, you guessed it, more noticeable black triangles.
Whoa, okay, had no idea it could get that intense.
Teeth.
So these little triangles, they're like the tip of the iceberg for gum health problems.
Bingo! You got it! That's exactly why this whole deep dive thing is so important. It's about looking deeper, not just the surface, figuring out the why behind something so common.
Totally. And it's interesting, the article, it didn't just say gum disease, it talked about aging too, like just getting older.
Yeah.
And even like brushing your teeth too hard.
Yeah, and that's what gets me. We blame it on not being hygienic enough, but it's more complicated than that, you know? Like you're brushing, trying to do the right thing, but all that force, it can actually hurt your gums, and then bam, recession, and those triangles.
So it's a balance, right?
Mm.
You got to brush good, but not go crazy with it. And that's what I like about this article. It doesn't just say you're doing it wrong. It's like, here's what's up and here's how to take charge.
Exactly. Knowledge is power. When you know the details, it can really make a difference.
Okay, so speaking of making a difference, the risks. We get it. Black triangles, maybe not the cutest look, but are they actually bad for you, health-wise? Like, what happens if we just ignore them?
Well, remember how we said those triangles? They're like little red flags. You ignore them, you're ignoring what's going on underneath, and usually that means inflammation, maybe even bone loss.
And I'm guessing that can't be good for your teeth in the long run?
Not good at all. Imagine this. Those little gaps between your teeth, those triangles, they become like these perfect little apartments for food to get stuck in, and bacteria, oh, they love it there.
Oh, no, like in the article, they called it a food trap, right?
Spot on. But it's not just about stuff getting stuck. The bacteria living it up in those pockets, they release these nasty toxins, and those toxins, they make the gum problem even worse.
Ugh, gross.
It's a vicious cycle. Gums recede, you get the triangles trap food and bacteria. The bacteria make the recession worse. It's a slippery slope.
So it's not just about looks. It can really mess things up. This is kind of scary, actually.
True, but hey, don't freak out. You know what they say? Knowledge is power. And you're here, you're learning, you're ahead of the game. And the good news is, this article, it's got the goods on prevention and solutions.
Okay, phew. So before we get to the fixes, what can we even do to stop this whole vicious cycle thing? Or, like, even better, not even let it start in the first place?
Right, so some stuff like genetics, getting older, that's just how it is. Not much we can do. But there's a lot we can control, and it starts with those everyday things.
You mean like being nicer to my gums when I brush?
Exactly. Sounds weird, right? But use a soft, bristled brush and be gentle. Think of it like you're massaging your gums, not trying to scrub them off.
Okay, that makes sense. And flossing. Got to keep doing that,
Yeah.
right? No getting
Okay,
out of it.
gotta floss? Gets rid of all that food debris and bacteria hiding out. Same idea, though, gentle. You're sliding it, not trying to soften your teeth.
So technique matters, not just doing it every day.
Huge difference. And it's not just about the brushing and flossing either. What you're putting in your body, big impact there, too.
Wait, you mean what I eat? The article said something about sugar being like junk food for the bad bacteria.
100%. Sugar, it's like throwing gasoline on a fire when it comes to gum disease. Those bacteria, they go nuts for it. And then they spit out these acids, and that attacks your teeth and gums.
Double whammy. So less soda, less candy. Good for the teeth, good for the gums.
Exactly. You're giving your gums a fighting chance. And while we're on the don't list...
Smoking, yeah, bad all around, I know.
Right. Like you needed another reason to quit, but add avoiding black triangles to the list. Smoking, it chokes off the blood flow to your gums so they can't heal as well, can't fight off infection.
Man, it's all connected, isn't it?
Yeah.
Okay, but what about people who already have black triangles? Can you actually fix the damage that's already there?
Don't worry, there are solutions. What works best depends on how bad it is, Sometimes just upping your hygiene game, that's all it takes.
Really? So if someone starts brushing gentler, flossing right, ditching the sugar, they might see those triangles shrink.
Possible, especially if it's caught early. But, gotta be realistic, if the gums have receded a lot, those changes alone might not cut it. That's where your dentist comes in.
Ah, right. So now we're getting into the solutions part of the article. I gotta say, I was a little lost with all the different things they talked about.
Totally get it, it's a lot. But that's the beauty of this, right? You're armed with info, so when you talk to your dentist, you're not starting from zero.
Exactly. So break it down for us. They mentioned some simpler stuff first, like professional cleanings and this thing called hyaluronic acid.
Right, so those professional cleanings, those are key. They blast away all that plaque and tartar that builds up, and that stuff contributes to gum disease. Think of it like a spa day for your gums.
I like it. Makes sense. But hyaluronic acid rings a bell, but I don't actually know what it is.
It's actually something your body makes naturally. It's all about tissue regeneration, attracting and holding moisture. And get this, dentists are now using it to treat gum recession.
So it's like giving your body a nudge in the right direction, helping it heal itself.
Nailed it. They can put it right on your gums, like a gel, or use it during other procedures, like gum grafting.
Gum grafting.
Oh, that
sounds a lot more intense.
It can be, yeah. They basically take a little piece of gum tissue, usually from the roof of your mouth, and put it where your gums have receded.
Like they're rebuilding the foundation.
Exactly, giving your gums a second chance.
That's wild. But I'm guessing that's not the first thing they try, right?
You're right. They usually save gum grafting for when a lot of gum tissue is gone, like when other stuff like that hyaluronic acid probably wouldn't do enough.
This is blowing my mind. Okay, gotta ask, before we go too deep down the rabbit hole, you mentioned this before. Talking to the dentist.
Can't stress that enough. Everyone's mouth is different. There's no magic fix that works for everyone. Your dentist, they can see what's up with you, think about your whole health situation, and figure out the best plan.
So even if someone's like, whoa, too much info, the main takeaway is go get checked out.
Absolutely. Think of this deep dive as your cheat sheet, get you prepped. But the actual diagnosis, the treatment, that's for the pros.
Makes sense. Now, the article also mentioned bonding and veneers. Those sounded kind of like cosmetic fixes. Do they actually help the gum problem or just make it look better?
Good question. It's key to remember. Those treatments, they might camouflage those black triangles, but they're not addressing the root cause if it's gum disease causing it.
So kind of like putting a Band-Aid on a bigger problem.
In a way, yeah. Bonding, that's where they use this tooth-colored resin to fill in those gaps. Instant improvement looks wise, but it won't stop the gums from receding more.
Got it. And veneers, those are like thin little covers they put on your teeth, right?
Yep, custom made, fit right over your teeth, can totally transform your smile. But again, mostly cosmetic. If you don't fix the gum problem, those veneers might not fit right down the line as the gums keep receding.
So fix the root cause first, then worry about making it look pretty.
You got it.
This is so helpful. I feel like I'm learning a whole new language here. Gum Health 101. Speaking of which, orthodontics, braces, all that. The article mentioned it as both a cause and a solution for black triangles. Wait, what?
I know, right? It seems counterintuitive. But how your teeth line up, that can actually make gum recession and those triangles worse.
Really? How does that work?
So let's say your teeth are all crowded together, or maybe they're spaced out too far. That can put pressure on your gums, make them more likely to recede.
So it's not just about having straight teeth. It's about how everything fits together.
Bingo. And that's where orthodontics comes in. Braces, clear aligners, They fix those alignment issues, take the pressure off your gums, and over time, that can actually improve your gum health.
But you said it could be a cost, too.
Yeah, it's true. Sometimes orthodontic treatment, if it's not done right, it can actually make gum recession worse for some people. It's a bit of a double-edged sword.
So you got to find a good orthodontist, someone who gets all this and knows what they're doing.
Exactly. It's about seeing the whole picture, your bite, your gums, your overall goals, everything.
This is fascinating, like a whole new world just opened up. Or should I say, a whole new mouth?
Yeah.
Okay, bad joke, sorry. But seriously, this is amazing information.
Glad you're finding it helpful. Knowledge is power, right? The more you know about your oral health, the better choices you can make.
It really is wild, all this stuff. We're learning about something as tiny as these black triangles. It's like a whole new perspective on oral health, you know?
I know, right? And speaking of new perspectives, one of the things that really struck me in all this is the link between your gums and your overall health.
Yeah.
We've been so focused on what's going on in the mouth,
Right.
but it's not like it's cut off from the rest of you.
Yeah, the article mentioned something about gum disease being linked to other health problems, but it didn't really go into detail. What's the connection there?
Well, for the longest time, people thought it's just the mouth, it's separate. But now research is showing that inflammation in your mouth, especially when it's chronic, like with gum disease,
Yeah.
it can actually impact your whole body.
So it's not just about your teeth and gums.
Whoop, not at all. See, the bacteria from gum disease and the inflammation itself, it can actually get into your bloodstream, and once it's in there, it can travel. So now you've got this inflammation response happening in other parts of your body, and that's been linked to some pretty serious stuff. Heart disease, stroke, diabetes, even problems with your breathing.
Wow, I had no idea it was that big of a deal.
Yeah.
So taking care of your gums, it's really about taking care of your whole self.
Exactly. It's all connected. And that's what makes this deep dive so important. We're not just talking about some cosmetic thing with your teeth. We're talking about your overall well-being.
Seriously. It makes you realize that those little things we do every day, like brushing gently and flossing, they have a bigger impact than we think.
100%. It all comes back to prevention, catching things early. So if you're seeing those black triangles, don't brush it off. Literally, talk to your dentist, figure out what's going on, and take care of it. You're not just protecting your smile, you're protecting your health.
Couldn't have said it better myself. This deep dive has been, honestly, kind of a wake-up call. It's amazing how much there is to know about something we all deal with.
It's true, isn't it? But that's the beauty of it, right? Learning new stuff, digging deeper.
That's what we're all about. Big thanks to you, our awesome listener, for coming along on this journey with us. This is just the beginning. Keep those questions coming, keep exploring, and most importantly, keep rocking that amazing smile.